Hello, I'm Irvine Mayor Christina Shea. With me today is CEO of UCI Health, Lefteris, Vice Mayor Mike Carroll, and Police Chief Mike Hamel. As we enter another week in our fight against COVID-19, I want to update you on our latest efforts to protect our community. As of today, there are 103 confirmed cases of COVID-19 in Irvine and 1,299 in Orange County. There are no confirmed deaths in our city. Our city numbers are low compared to other cities in Orange County based on population. Last Friday, the City Council and I met for a special meeting to discuss additional safeguards we could put in place to help protect our residents, our families, and business employees. Our council is united in our resolve to protect the public and unanimously ratified the executive order released by the Director of Emergency Services that mandated that employees of essential retail and commercial businesses must wear face coverings. Additionally, this executive order requires customers must also wear face coverings while in retail and commercial establishment. Further, all residents outdoors using our trails must maintain a 6-foot distancing, and this is required by law. Yesterday, Governor Newsom announced the Western States Pact. Together, California, Oregon, and Washington are working together on a shared approach for reopening our economies, one that identifies clear indicators for communities to restart public life and business. This is welcome news for all residents and businesses in our community. At our April 28th City Council meeting, I am bringing forward a fiscal update for our community to discuss the fiscal impacts of COVID-19 pandemic on our city's fiscal model. We will be discussing the business closures, employee layoff and furloughed, financial impacts to our city, and what proposals we will put forward to proactively address these concerns. Health officials have stressed that now is the time to double down on our efforts to flatten this curve. I appreciate that our residents have heeded instructions put in place for their safety, and I want to ask again that you continue to do the following so that we can emerge from this crisis as soon as possible. Number one, stay home unless you are an essential worker or must go out to the grocery store or other necessities. 2 is practice social distancing by staying at least 6 feet away from others when you're out for essential activities. Number 3, wear cloth face covering whenever you are in public, and remember to wash your hands frequently. Our collective efforts as a community and your efforts and sacrifice are working. Thank you. And now let me turn to CEO of UCI Health, Lefteris.
Good afternoon. My name is Lefteris. I'm the Chief Executive Officer at UCI Health. While we're located up in Orange, we take our role here in Orange County to be very important, and we serve all of the county, including the wonderful population here in Irvine. It's my privilege to stand before you today and give you a few insights into what we're working on across the campuses. And I'd like to start with letting you know that as the county's only academic medical center, we were made for this exact moment. We plan, we practice, and we drill for surges and for pandemics. We don't always know what is going to cause that surge, but we plan for this. And I want you to know that you're in very good hands because of that. We started tracking this pandemic when it was on the other side of the globe many months ago. We stood up our preparations as early as late December to prepare for the worst and hope for the best. We continue to work very closely with our colleagues across the entire county and to make sure that we're in lockstep with the latest information that's coming out, both nationally and internationally, to make sure that our caregivers are as well versed in everything that is happening. You may wonder, what is it like to be an academic medical center? And what does that mean to the community? And there are several great examples. One is our access to clinical trials. Just today, we're one of several centers who are participating in an interesting NIH-sponsored clinical trial, which is going to bring very important information, very early information, but promising information as it relates to the treatment of these patients. That's something that only an academic medical center can do, and you have that here in your backyard. We're also partnering with our colleagues on campus, here on the main UCI campus in Irvine, to create 3D printed face shields and other things that are very hard to get today via the normal inventory or supply lines. And so we're able to partner with colleagues, brilliant colleagues on campus, that in a matter of days, created an amazing resource for us. And we've shared these with other hospitals that we know are short on supply because they're so hard to get. So you should be aware that we also have testing available for patients or loved ones who may require it. Anyone can get a test to see if they're COVID positive. There is a nurse triage line to call, and I'm going to read out the phone number because I want to make sure that you have it. Again, to call the nurse triage line, it's 949-824-8600. Again, 949-824-8600. That's the UCI Health nurse triage or testing line. They will walk you through several questions to screen you for testing. And you may wonder, why do I need to be screened? I just want to get tested. The reason why we need to screen you for testing is that, unfortunately, while we have an amazing ability to test now versus what we had when this event started just now a few weeks back, we still have limited resources, and all of our supply lines across all the healthcare settings are really challenged. So we want to go through the screening to make sure we're testing the right people, not just everyone quite yet. At UCI, we were the first in the county to be able to do in-house testing. We're very proud of that because it took a lot to turn that on quickly. And we're very proud of our laboratory teams for doing that so fast. That means today we can test close to 1,000 people a day. But again, we want to make sure that we're utilizing our resources very, very tightly and making sure that we're testing those that are in need. Coming out next week is the next phase of testing. You may have heard about it in the news. It's the antibody or serologic testing, the blood test. That's going to be very important information as we go into the next wave of this surge or the next wave that's coming in the fall. We don't know. So having these additional testing platforms is going to be extremely important to the health of the overall community and planning ahead. So again, we continue to meet the testing demands of the local community as well as other healthcare providers. They've called on us to ask them to provide testing for their coworkers that may have been impacted or other patients. So we're very grateful and happy to do that for others, and we see that as a role in as our role within the community. We do have 2 sites. Once you go through the screening, you can drive-through testing that's available, and that's located here at the main UCI campus at the Gottschalk Medical Plaza here in Irvine, as well as we have another drive-through testing site located up at our Orange Medical Center main campus as well. So as you go through, they can direct you to one of those 2 through the nurse triage line as well. And the final thing I'd like to say is really thank you to the entire community for supporting us, but also I would be remiss if I didn't say thank you to our staff. They are fighting this fight every moment of the day, and this is hard work, and they are at it, and they are running to the fight, actually. So I couldn't be more proud of the work that they are doing, all of the caregivers that are working tirelessly to make sure that we're protecting our community. So thank you very, very much. Have a great afternoon.
Hi, I am Vice Mayor Mike Carroll, and I would like to share some important informational updates with you. First, I want to thank you, Irvine, for being a strong community that is working together to fight this battle. Each day, I'm asked what I'm working on as a member of the Irvine City Council. It's pretty straightforward. My job right now is twofold: to provide information and to help and comfort our citizens. Stay-at-home orders still remain in place, and we understand the impact that this has on our senior and at-risk community and on everyone else as well. We know it is not easy. Rest assured, we are taking every step necessary to ensure that services and critical services remain intact. The Meals on Wheels program continues with the delivery of meals to our homebound seniors. This program delivers 3 meals per day to residents. Additionally, the Congregate Lunch Program, which was normally provided at Lakeview Senior Center at lunch, is now taking place in the form of at-home delivery. This program delivers 1 meal per day. Both programs have eligibility requirements, but if you do not meet the program eligibility and you are in need, please still call us. We are also doing grocery delivery and prescription pickup for our residents that are at risk. We will get you in touch with the help and the additional resources that you need. And we will not let anyone who is in need of assistance go without help in our city. That is our city's commitment to you. Staying at home is a big part of fighting this battle. Please check in with your older and at-risk neighbors, whether it be a simple phone call or a text. Ask how you can help in the event they're having trouble getting groceries or medication or other necessities. Earlier in this crisis, the governor said this: "It will be decisions, not conditions, that determine our future." The power and the potency we have as individuals resides in each and every one of us to make good decisions. I agree, and I hope you do as well. Our goal here at Irvine is to do everything possible to ensure that this city and its 280,000 residents continue to enjoy the highest level of safety that has become our shared expectation. Remember, we will get through this together as a community. Thank you. And now I would like to introduce our Chief of Police, Chief Mike Hamel, for some brief remarks.
Hi, I'm Irvine Police Chief Mike Hamel. I'd like to give you an update on the calls related to COVID-19 and our response as a police department. Since the governor issued the stay-at-home order on March 19, IPD has responded to many calls for service related to violations of our order. So far, our personnel have been successful in educating members of our community and gaining voluntary compliance. Please continue to adhere to the order and only go out when engaged in essential activities and while maintaining social distancing. As the mayor mentioned, the city's new executive order requires that essential businesses require their employees and customers to wear face coverings. In order to be compliant with this order and set the example for others, face coverings are now mandatory for all Irvine Police Department employees while in the field and outside their vehicles or working in the police station. IPD has also been conducting outreach to our essential business community to provide information about the new order, and we continue to do so this week. Again, our goal is to obtain voluntary compliance with this order. However, businesses who don't comply after receiving one warning will be cited. If you would like to report a business that is not complying with this order, you can call our hotline at 949-724-8250. Please understand our primary goal in enforcing this ordinance is to slow the spread of this virus and help keep our community healthy. Thank you in advance for your cooperation, and remember, we will get through this together.
Thank you, Chief Hamel. I would also like to thank Chad Lefteris and Vice Mayor Carroll for joining us today. I want to once again encourage our families to stay safe. For information on where to obtain cloth face coverings, would you please go to our website, where you'll also find other important resources and the latest news and information about COVID-19. And if you have any concerns or needs, please contact us here at the city. And the number is 949-724-8250. We are here to help you. I'm Mayor Christina Shea, and thank you so very much for watching.